And we are live. Hey, Joe.
Hey, how are you?
Welcome to Doc Talk Live.
Happy to be here.
I'm always trying to work out the mechanics of this. So, Dr. Ingram, Joe Ingram, is a orthopedic surgeon that specializes in hands, right?
Correct.
And so the first thing that always comes to my mind when I think of hand problems is carpal tunnel.
As with everybody.
Okay, so why don't you tell us a little bit about carpal tunnel?
Yeah, so all hand problems are not carpal tunnel, but that's everyone's general first thought.
Okay.
So I have hand pain, I must have carpal tunnel. So generally the things we look for, there's some pretty consistent symptoms that you'll see in a lot of people when they have carpal tunnel, and then you'll see people outside of the box a little bit that can have carpal tunnel. But for the most part, people that come in complaining of pain at night when they sleep. The median nerve that supplies this side of the hand.
There you go. The
thumb side of the hand.
These
3.5 digits here. It runs through a tunnel that goes through the wrist, and when we sleep in all these contorted positions, and so it gets kinked off, and you'll wake up, and people say they have to shake their hands. The primary symptoms of carpal tunnel are going to be numbness and tingling, like I said, in these 3.5 fingers. You can see pain as well that comes from this nerve being pinched off.
How common is it?
It's exceptionally common. People of all ages get it. There's no male or female dominance. Anyone can get it any age at any time. And it can come and it can go, and then it can show up years later. Or sometimes people do require treatment in order to improve.
The most common treatment are to wear these wrist splints at night.
Correct.
But you're a surgeon, so just do me a favor and just focus on the surgery a little bit. Tell us a little bit about what's involved in that.
For sure. So if you wear splints and such at night and your pain doesn't improve, then we progress on the algorithm of treatment. And if you reach the point of where it's so bothersome, nothing else has worked, medications, injections, splints, then we talk about doing a carpal tunnel release. The problem with carpal tunnel is that all your flexor tendons, or all your tendons that cause your hand to bend down, so they curl your hand into a fist. All those tendons run through the same tunnel as that nerve right here coming through the wrist. There is a ligament that spans that tunnel. It's basically the roof of the tunnel, if you will, called the transverse carpal ligament. And what happens is those tendons get inflamed. It pinches off the nerve and decreases the space. We go in, we make a little tiny incision, and we transect that ligament to basically takes the roof and it opens it up.
I hate to do this to you, but you get in the airplane and you see that you open up the magazine and they have come up with a minimally invasive treatment for a minimally invasive surgery. So I'm not sure I completely understand the concept there of what I'm seeing in the airplane magazine.
That's true. There's multiple ways to do the surgery. In my training, we did both, but I prefer to do it open, and I prefer to do it open for this reason. If you open the carpal tunnel and you visualize the ligament itself, there are no questions whether you've completely released the tunnel. And anytime you put a scope, or a microscopic procedure, anytime you put a scope into the wrist, you can see it on a TV, but to me, there's nothing better than seeing it with your own eyes, actually looking at it.
And how quickly do they get better from this procedure? So
you'll wake up from the procedure. Night pain is gone is the first thing that improves. You'll go to sleep that night and your night pain will not be present. Numbness and tingling coming back. So if you have consistent numbness in your hands, the amount of return of sensation or the numbness completely going away is variable. It depends on how long you've had carpal tunnel. It depends on the degree of which the nerve is compressed and multiple other factors. Oftentimes, if you have carpal tunnel that's caught early, you have surgery, generally the sensation will completely return to your fingers, but not always.
So in the beginning you said it's not always carpal tunnel.
Right.
So what are some of the other things that sort of mimic carpal tunnel, or where people come in and they say, I think I have carpal tunnel, but they've got wrist issues or hand issues? What are some of the more common things you see that is not carpal tunnel?
Some of the more common things you see is actually wrist or thumb base. So the thumb is right here. It's very close to the carpal tunnel. You can have base of the thumb arthritis. You can actually have wrist arthritis. And then there's a whole host of tendons that are on this side of the wrist that can be just a simple tendonitis.
Yeah, I think I actually have that. It's getting better, but I noticed from playing a lot of tennis that for whatever reason, I think it's
FCR.
FCR, yeah. Tell us about that since I've got you. I mean, I was really point tend to right along that.
That's exactly right. So there's two main tendons that will bend the wrist this way. Your flexor carpi ulnaris and your flexor carpi radialis and your flexor carpi ulnaris. The flexor carpi radialis, or the FCR tendon, is the one of the larger tendons that pulls the wrist down. And so if you overuse this tendon, it kind of dives down over a bone and it can get irritated.
Interesting.
And it is sitting right next to your carpal tunnel. And while the symptoms are somewhat the same, wrist pain, you don't generally see the numbness and tingling, and you don't have weakness necessarily in the fingertips.
Yeah, I just had a lot of pain.
A lot of pain. That's
right there. And I guess rest is about the only thing you can do, or
rest, anti-inflammatories of varying degrees, ranging from ibuprofen to a steroid pack.
Yeah. What about injections?
Injections are very useful. I like to do injections actually for carpal tunnel. For one, it can improve the symptoms, and some people get relief from that.
Sure.
It's an easy solution to a problem that is quite annoying. The other thing an injection will do is it gives you a good diagnostic evaluation in terms of the surgery is the best indicator of a successful surgery is a successful steroid injection.
Sure. Temporary,
so I typically tell people, while this may be temporary, this is going to be the best indicator of how well surgery is going to work for you. If you get 100% relief, then typically you'll get 100% relief from the surgery. So
I'm going to move on to another abnormality that interests me. And if people have questions, I see there's a couple people watching, but if people have questions, feel free to type them out and chime in.
There you go.
But Dupuytren's contracture, I'm going to promote this product, Xiaflex. I think it's pretty brilliant.
Yeah.
But maybe you could tell our viewers about what a Dupuytren's contracture is and sort of that medicine Xiaflex with regard to that.
For sure. So Dupuytren's, it's referred to as Dupuytren's disease. It's not a disease in the sense of the word like cancer is a disease, but we refer to it as Dupuytren's disease. Probably a better way to say is Dupuytren's, contracture or fibrosis. But basically, the palm of the hand is tough, and it's there, and that's that way because there's fibrous tissue that is on the palm of the hand that's specific to the hand, as opposed to anywhere else in the body. And people of Northern European descent, Viking descent, Scotch-Irish are going to be the predominant people that get this problem. And basically, you get proliferation, uncontrolled, of this fibrous tissue. And what happens is you get these cords or these bands in your palm, and eventually they can start drawing your fingers down into a position that's less functional. It's more often on this side of the hand for whatever reason. We're not exactly sure, but a lot of gentlemen come in that say it bothers me when I shake hands at work. It's a very common complaint when it gets to the point like this. Of course, now it can end up significant flexion contracture in the hand, and it becomes a serious problem. But the product you are referring to is called Xiaflex. It's a collagenase. It's from the botulinum line. It's not dangerous in terms of a disease, but it's a collagenase that goes in the hand, and basically you come in, you get the injection into the fibrous tissue. It starts dissolving that cord. The following day you come in and you get a manipulation, and generally that cord will separate.
Yeah, it will release.
It will.
And it's what I like about it's a biologic injection.
It is.
But it's not regenerative.
It's not.
It's destructive. But the flip side is you could do surgery on that, where you would open it up and actually incise that cord.
Correct.
And it seems to me, my experience with it has been that the recovery period is a lot quicker with the biologic.
That's true. As opposed to doing, you have to do if you do a definitive procedure, it requires you to make an incision extending the length of that cord, is what we call them, and then actually cutting out that diseased tissue.
How long does it take to recover from that operation?
It depends. Depends on the severity of your cord. We have done as many as 4-finger Dupuytren's releases.
Wow.
And so you have incisions down each and every finger. And so it takes a little while for the incisions to heal.
How long would that take?
For the incision to completely heal is several weeks.
Okay.
The problem is the skin contracts with everything else, and so when you straighten the hand back out, sometimes you're missing a little skin that has to, regenerate, if you will.
Here's a good one for you. I noticed that when I as I was sitting here, I popped my knuckles. A nervous habit I have. I get this question all the time.
Does it cause
arthritis? Hey doc, is popping your knuckles bad for you?
There hasn't been anything to show that it causes arthritis or it exacerbates arthritis. Generally, it's typically a piece of soft tissue that is popping over something or a tendon sliding around, something of that nature. It's not the actual joint popping itself.
I love it.
But yes, that's a very common question.
All right, we'll stop it there, and I appreciate your time.
My pleasure. Thanks for having me.
As interesting stuff comes along, I hope you'll share it with us, and maybe we can, even look at images and things like that. And
be happy to. Anytime.
Appreciate it.
Thank you, sir.
Thanks.
All right.
Thanks, y'all.